Hello, I'm Dr. Shelley with Shelley's Nursing Review up in Cleveland, Ohio, and HETV on YouTube. For today's lesson or video, we will be talking about osteoarthritis specifically, but we will also compare and contrast osteoarthritis with rheumatoid arthritis. There are differences and they show up on tests all the time. So we want you to know the differences because typically when you get a case study, it's going to have these concepts in the case study. Now, for preparation for today's video, you will need ortho and joint replacements. More so joint replacements, but these two go together. Remember that ortho is your acute musculoskeletal and that joint replacements is your chronic conditions. So that's how we separate those two packets, right? Okay, so these are obviously available through my link on HETV called PayHip. You can get the whole bang buster for whatever. All right, so now let's look at what we have because it's very important. These are extremely common conditions that patients suffer with. Even myself, I've suffered with some of the stuff behind me on this board. So let's dig in. First of all, like I said, this video is on osteoarthritis primarily. I will do a separate video on rheumatoid arthritis so that you can kind of see the focus will be all rheumatoid arthritis with the comparison chart like this one. But today's video is simple. It's osteoarthritis. Osteoarthritis by definition is pain and stiffness with decreased range of motion in the joints due to the breakdown of cartilage. I want you to think of this as a wear and tear. So this patient is usually older. So it's O for osteoarthritis, O for older patient, okay? Years of wear and tear have caused this type of arthritis, all right? Now, when we look at which joints are mostly affected, we're talking big weight-bearing joints. Spine, hips, and knees primarily. But it can also be shoulders and also hands. Be very careful. Knees, spine, and hips are weight-bearing joints. They are primarily the most affected. Again, you could also have shoulders and even your hands. There is swelling at the time, sometimes, of this pain and tenderness. There is crepitus, which just means two joints or bones rubbing against each other, colliding with each other in the joint itself, and it has a grating feeling and a crunchy kind of sound. I mean, you can hear it. You heard my knee popping, you know, okay? So that crepitus is very common. Decreased range of motion, you can't do everything you used to do with that joint. Bone spurs are very common and enlargement of the joints itself. So those are all what we see with osteoarthritis. What are the risk factors? Well, the risk factors include an overuse of those joints. We'll see this with construction workers, plumbers, seamstress, different occupations. You'll see that this is very common with them. Repetitive use, that could be your athletes doing the same exact thing day in and day out, okay? Prior injury, definitely your athletes. Steroid use, why? Well, you know, steroid use causes osteoporosis and already weakens the bone, thins the skin, and so we often will see a history of steroid use. But guess what's number one? Are you ready? Yeah, obesity. You knew we had to put obesity in there somewhere, right? Obesity is a big, huge, giant number one risk factor for Osteoarthritis. In fact, you won't believe this, but when people lose a significant amount of weight and they signed up for like a knee replacement or a hip replacement down the road somewhere, because if you know anything about those elective surgeries, if you sign up for a knee or hip replacement, it's usually months down the road. Well, here's what happens. We see patients who've lost a considerable amount of weight through either the GLP-1 Ozempic shots or bariatric surgery or some other method, maybe just self-discipline. I don't have it. I don't know how y'all do it because I needed help, okay? Them shots was the bomb. So if patients lose weight, significant amount of weight, they may not even complain about their back hurting or their knees hurting or their hip hurting. And that's important because that means they can cancel that knee replacement or whatever if so inclined. So again, obesity is number one. Y'all heard me? I'm gonna say that one more damn again. Obesity is the number one risk factor. BMI greater than 25 is considered overweight. Greater than 30 is considered obese. So you got to know this. Diabetes is a risk factor. Age, it goes without saying, and being an athlete, of course. Okay, so you get it. This is not like rocket science. How do we diagnose this patient? To be honest, a clinical exam and putting all these risk factors together with what's going on with the patient. But X-ray can help confirm that diagnosis. Now, here's what you don't need to diagnose this patient. You don't need any labs at all. There's no such thing as checking an ESR, erythro sedimentation rate, or CRP, C-reactive protein. You don't need that shit because that's rheumatoid arthritis. That's all inflammatory markers, has nothing to do with osteoarthritis. This patient's labs will be basically normal, and it's stupid to even check them, wasting their money. The treatments, well, there are a ton of treatments. What I always like to cover first, and I need you to get your pen and paper out if you didn't already, because you're going to be in trouble if you didn't. I need you to write these down, okay? And also, when we're looking at this joint replacement packet, it has a lot of the treatments in there, like steroids, like Celebrex, which we're going to talk about, like NSAIDs, which are part of the treatment. So I need you to get it together and have your shit out, ready, willing, and able to do the damn thing. Here's what you don't want to use for arthritis. You don't want to use opioids. That would be ridiculous. Yeah, you already got enough addiction out here. Quit trying to make folks on drugs, right? No. Okay, so we're going to talk about that. But for now, I need you to get your basic care and comfort hat on. Remember, basic care and comfort is the number one area of failure with reduction of risk. So what I'm about to cover right now is basic care and comfort for osteoarthritis. Come on, hang on in there with me. Aqua therapy is one of the best regimens you can use to treat the patient with osteoarthritis. They get in that swimming pool, and my cousin, who is part of my program up here in Cleveland, my cousin said that damn water therapy made her feel so good. I watched her. It gave her life back. Plus, she lost weight, honey. She'd be looking good. So, aqua therapy. The patient could benefit from a neck pillow. I myself have found that those airport neck pillows actually work really well to cut down on any back pain, especially upper back pain and neck pain. I mean, like, I love my little airport pillow, just saying. Weight loss. How many different damn times I got to say lose some damn weight, okay? So whatever you got to do, start a walk-in program, cut the pop and the soda, whatever y'all call it, wherever y'all at. Cut all pop, soda, and juice out. Sugar is the enemy. It's the devil. Take your ass around the corner and through the woods to get them little weight loss shots called Ozempic or GLP-1, bariatric surgery. I don't know what you got to do, but weight is a big problem. And I'm not trying to have pain from just weight issues, but this is exactly the chronic condition that is related to weight. So weight loss. Here's one for all of you little bougie ladies like myself. If you tend to get your every 2-week mani-pedis, manicure pedicures, you may remember, I remember myself and me taking my youngest daughter for mother and daughter pedicures and manicures, and we got at that time paraffin wax treatment. It was where you take your hands and you bury them in this really warm, soothing wax, paraffin wax treatment. And they said that that helps tremendously with arthritis that is in the hands. I too have gotten steroid shots. I was heavier. After my little weight loss shots, I lost a good 20, 30 pounds. And when I was heavier, this shoulder was so bad, I would get steroid injections in the shoulder, and I will tell you right now, that took all the pain away. The only problem with that is usually the doctor will tell you you're limited to 2 or 3 a year because guess what? They increase the risk of osteoporosis, not to mention you are the bomb.com. You know that steroids increase your blood pressure, increase your blood sugar, decrease your immune system. You already know that. So steroid injections is like a last resort kind of thing that worked for me, worked really well. But what worked better was weight loss. I'm gonna keep saying it. Physical therapy, occupational therapy. Physical therapy concentrates on the big joints, especially below the waist, physical therapy. And occupational therapy focuses on the little joints above the waist and helping you do ordinary daily tasks, opening jars, using utensils, how to use these hands when they hurt, what not to do. Physical therapy, occupational therapy. Ultrasound treatments. This is basically heat. The gel and everything, the ultrasound therapy to your back, that can help. These are all, again, non-pharmaceutical treatments, okay? Canes and walkers. These are your adaptive devices. They are wonderful. They take the weight off the joint, trying to help you keep your balance and be safer. Those are highly recommended for a lot of people. Hot tubs. Honey, don't tell me that. I've been to put one in my deck outside and in the house. But the hot tubs are obviously soothing. That's why a lot of times at the gym, you'll see people racing for the hot tub. And for sure, I just got off a cruise ship. We saw a lot of folks in that damn hot tub on the cruise. Walking and other core and muscle strengthening exercises. You know, you gotta take the stairs. You gotta walk. You gotta do things to strengthen your muscles. And I swear to God, I've got to do better. I've been a lazy ass for about, maybe a couple weeks, stretching into a month or so. I've got to get back together, okay? Got to get my life back, get my life right with Jesus, okay? All right, so these are very important. Some really exciting therapies, especially for the knees, includes regenerative therapy using plasma or stem cells to regrow the cartilage. That's cool. But ultimately, some of these patients may opt, especially if they're 65 and older, they may opt for a joint replacement. This is called arthroplasty. I need y'all to know that. Did you write that down? Oh, I don't know. Did you? I hope you did. It's called, again, arthroplasty. It is a joint replacement. Now, I did want to pull your attention to two funky $4 words. Bouchard's and Heberden's nodes are red, painful, nodular deformities on the fingers. That is something that is strictly osteoarthritis. So Heberden's is H for Heberden's and H for hand. Okay. Now, in the red, are some more treatments, but they have medication in them. They are basic care and comfort. It's just whenever we ask you about basic care and comfort, you want either over-the-counter or non-pharmaceutical type of therapies first. You knew that. So let's go over some of these. I've used some, you know, whatever. Celecoxib. That's a COX-2 inhibitor. It's a medication by prescription. It does cause vasoconstriction, so you have to be careful with cardiac issues. And it can cause some GI upset. It's similar to an NSAID, but it's not an NSAID. It's a COX-2 inhibitor. The brand name is called Celebrex. You got to write that down. It's popular on test. Okay. Capsaicin is over the counter, OTC, over the counter. Capsaicin. This is a topical cream. Your girl is stupid. I had no idea. It burns like a fire, and I put it wherever I needed to put it, and it worked. But then somehow, some way, I don't know how, I must have touched my eye and intense burning ensued. I am a nurse. I've been a healthcare provider, delivering babies, OBGYN. So I have hands that have microscopic cuts all over them from working in water all day and wearing gloves and just crap nurses and doctors go through. And the burning got through there. So guess what? Don't be a Shelly belly. Get you some gloves, honey, because this will burn. This is made of red peppers, red hot peppers, but that shit did take the pain away. Keeping it real, it works. NSAIDs and Tylenol. Tylenol is really acetaminophen. Let's tackle one at a time because sometimes y'all get them mixed up. Remember, when we're talking about NSAIDs, we're talking about Advil, Motrin, ibuprofen, Aleve. Don't fuck this up. Let's do it again. Ibuprofen, Motrin, Advil, and Aleve. Out of those four, Aleve is the most different. You will fuck around and find out. F-A-F-O. Fuck around and find out if you treat Aleve like you do the other three, the ibuprofen, Motrin, and Advil, you're going to overdose like crazy and have a GI bleed. Be careful. I'm telling you. Be very careful. Please do not take any more than 3 tablets total, not at the same time. 3 tablets, over-the-counter tablets total of Aleve in a day. Please don't do that. Don't do any more than that. Okay, I'm watching you. Overall safety for NSAIDs, because they can cause a GI bleed, a stomach ulcer, bleeding, prolonged bleeding. They can cause all kinds of things, right? They have their issues. They're not allowed with kidney failure. You're not allowed to take them with hypertension. You shouldn't have your hands on them if you've had bariatric surgery. You shouldn't be doing anything with NSAIDs if you have had a heart attack or stroke before, or you have hypertension and you're treated with 2-3 meds. You should not be taking an NSAID. And everybody does not think like that. They just go out of here because it's over the counter. They think it's safe. Well, it is safe for people who don't have any of those things. You have to be very careful. I would say to people who can take those after they talked with their doctor or their nurse practitioner, never to take any more than 3,200 milligrams in a day. Now, Tylenol or acetaminophen. You got to worry about NSAIDs with your kidneys. You got to worry about Tylenol with your liver. So if you have significant liver disease, you ain't got no business with no damn Tylenol, okay? And if you're going to take Tylenol, 3,000 milligrams is the safe limit. Some say 4,000. Let's be safer than that. A lot of resources say 3,000 milligrams in a day. I hope you're writing this shit down. And actually, I hope your crazy behind pulled out your pharmacology packet, because while I'm sitting up here talking about all these medications, you already have the pharmacology packet. And if you bought my pink packets, you should have already had the pharmacology. And this is the one you should be writing in, because it already has steroids. It's got NSAIDs. I just want to show you real quick because it is worth its weight in gold. Let me just show you what page we're on talking about this stuff. So when it comes to these medications, they're like Selectols and everything else. So I want to show you this. This is a whole page on steroids. Like, I hooked you up. So that's one page, right? Here's a whole nother page on NSAIDs. See that? NSAIDs. It even starts earlier on page 12. NSAIDs. There's a nice little chart for you of all the action of NSAIDs and more and more and more, because your ass got to know that shit. Yeah, get your shit together, y'all. So you can buy that later. I'll tell you how to get that later. But there you go. You got your medications. Now let's move on. There are 3 other red treatments on my board. One is diclofenac, my favorite. Like, seriously, diclofenac was made in heaven. This is an over-the-counter topical gel or cream. If you're buying it over the counter, it's called Voltaren. About $10, $15, well, no, $15, $20 a tube. It works wonders. It is, however, a topical NSAID. So you still have some of the same restrictions, but it's not going to eat away your gut, and that's important. I swear by diclofenac for back pain, for knee pain, for Achilles tendon pain, for wrist pain, for shoulder pain. That shit works, okay? You may also have heard of lidocaine patches or salon spas. We use those too. I didn't write it up here. I probably should have. They're just lidocaine patches, okay? Don't get crazy. Here's another one. This is alternative therapy. People swear by it. I don't have any more pain because I lost the weight, but if you have some, try this. Glucosamine and chondroitin therapy is over-the-counter supplements, and people swear up and down that shit work. Studies have shown some pretty good, like, signs that this is a good thing to do. All right, now, are you ready? Pot. Now, let me help you out with this, because your ass, you don't even have arthritis, but you're going to get the pot. Okay, no. I'm talking about arthritis here, osteoarthritis. Marijuana has been said to be pretty effective. Now, I have a little secret for you, because, I like to keep it real, be transparent. That way I know you guys will kind of keep it honest and have integrity. So let me just share this with you, because you're family. My bucket list, because I've never smoked pot, I don't know what it feels like. The one time I thought I tried it, I don't remember feeling any difference. I probably did it wrong. But I really want to truly, before I go up out of here and go to heaven or wherever I'm going, I want to get fucked up on pot. Like, I want to get high, like high. Yeah. It's my bucket list. Yeah. Now that the shit is legal, I'm more likely to try it. You know what I mean? Like, I'm thinking it might be something I want to do before I go to heaven. I'm just saying. I just had to get that off my chest. Anyway, moving on. Now, we have osteoarthritis, and I want to share with you how to compare it and understand the differences between OA and RA, which is rheumatoid arthritis. So watch this. You know how we do it, right? We go back and forth, back and forth, back and forth. Y'all got it? All right, here we go. Osteoarthritis, O for osteo, O for older age, older than 50. Rheumatoid arthritis, the onset is a younger age, as young as 30 or even 20, between 30 and 50, but younger women, women more so as well, although women and men do OA, but women have this more so because women have more autoimmune diseases. But I need you to know that younger age thing, okay? Here we go, watch this. Unilateral, bilateral. Osteoarthritis has large weight-bearing joints. Rheumatoid arthritis has smaller joints, your wrists, your fingers, your elbows. Osteoarthritis is more localized to the joint itself and nothing else. Rheumatoid arthritis is systemic. Other parts of the body are affected. This patient could be anemic. They could be extremely tired, exhausted, stressed. They could have a low-grade temperature. Osteoarthritis is from wear and tear. Rheumatoid arthritis is due to autoimmune disease. Osteoarthritis is from the breakdown of cartilage. Rheumatoid arthritis is from inflammation of the synovium, which is the lining of the joints. Inflammation. Osteoarthritis, brief morning stiffness. Rheumatoid arthritis, hours-long stiffness and pain in the morning. Hours. Osteoarthritis, the pain worsens later in the day. Rheumatoid arthritis, it improves throughout the day. Osteoarthritis, crepitus is common. Rheumatoid arthritis, deformities are common. Osteoarthritis, no exacerbations and remissions. Rheumatoid arthritis, exacerbations and remissions like most autoimmune diseases. That's what you got to know about autoimmune diseases. Autoimmune diseases are always plagued with remissions and exacerbations. Exacerbations is another word for flare-ups, okay? Osteoarthritis, NSAIDs, Tylenol, over-the-counter creams. Rheumatoid arthritis, DMARDs, biologicals, those medications that end in MAB or HIB or CEPT, DMARDs, right? They're in here. I told you y'all should have this damn thing out. This medication categories packet, don't get brand new with me now. I done told you to have your shit out. So let me show you what the DMARDs look like. You should have my pink packets. If you don't, we'll talk. But these are your DMARDs, your autoimmune, all that good stuff, okay? This is DMARDs, okay? You got to know that, all right? So there you go. And by the way, there's a whole page of information, and then it goes on to the very next page. So let's look at this. If we look at this page, you already know methotrexate is a big deal, okay? So you know, y'all already know. All right, so DMARDs, that's a bigger deal, and they need to be started right away. They're the first line therapy for rheumatoid arthritis. Osteoarthritis, no lab changes. Rheumatoid arthritis, yes, you're gonna have actual labs look crazy. Labs that are gonna change. High ESR, erythrosedimentation rate. High CRP, C-reactive protein. Low hemoglobin and hematocrit because the patient is very often anemic, okay? Now, look at this. I did what they differ in, right? I went back and forth and back and forth and back and forth. And now I'm going to tell you what they both have in common. Are you ready? Because we're almost finished. Both conditions, osteoarthritis and rheumatoid arthritis, obesity is the #1 risk factor. I told you I was going to keep saying that shit. Both OA and RA are worse with repetitive action or a history of an injury. Both need raised toilet seats, high chairs, grab bars, falls precautions, shower chairs, non-skid tread on the shower floor or the tub. Canes and walkers may help. They may need joint, here's that word, arthroscopy, arthroplasty. Joint arthroplasty just means a joint replacement, knee or hip replacement, whatever. Both may benefit from steroid injections into the joint. There is a higher incidence of both among military veterans, and both require multimodal therapies. Here's what I mean. Heat and cold, medications, pharmaceuticals, adaptive devices, physical therapy, occupational therapy, or even rehab. Now, you saw me showing you like all these little pink packets or whatever. If you want to inquire about those pink packets, you can go ahead and text me at 216-410-0936. Remember, I cannot wait to see you guys for the boot camp here in Cleveland, the 3-day boot camp. I'm excited about it. We always have them. If you're missing this November's, then make sure you show up for January's. November's is this weekend, 11, 22, 23, 24. This is your Friday, Saturday, Sunday. In January, it's January 17th, 18th, and 19th, Friday, Saturday, Sunday. And this is where we teach you how to pass your NCLEX by going over the NGN NCLEX test plan and giving you all 8 pink packets. Deuces, I hope you learned a lot. This is important. Share it with your parents. They all have, you know, little arthritis because it's an older folk thing. Bye-bye. Deuces.